A very good morning to you, Blaine, and to the scores of our audiences. Indeed, you are coming to us live from East London ahead of Dr. Zweli Mkhize's second visit. You'll remember that about 2 weeks ago, he was here in this province and he lashed out at the provincial leadership on how they are handling this issue. Part of the problem has always been the issuing of PPEs and also the growing number of positive cases and their tracking thereof. One will remember that he lambasted at them, saying that there is somehow not a balance between the number of positive cases and the number of deaths in the province. So he sort of delegated a number of senior people from the head office to the province so as to ascertain the condition on the ground. One will remember that since the relaxation of the borders, the inter-traveling between provinces, the number of positive cases has soared high. Let's now bring into the conversation the HOD of the department, Dr. Zweli Mkhize. Good morning to you, sir, and thank you very much for joining us. Tell us, how much has this relaxation of inter-traveling between provinces affected the province of the Eastern Cape?
Yes. You know, when the lockdown was started and the president declared the disaster, we knew that we were dealing with an epidemic that's uniquely very different from the ones that we've had before. Every South African is susceptible to get a COVID virus. And the key thing that needed to be done was really to slow down the transmission in the communities. But we also are very aware that as you slow down the transmission, you have to impose a very strict public health in terms of social distancing, wearing of masks, cleaning our hands, and actually making a mandatory quarantine of people. So the travel and the lockdown was really intended to solve the problem of high transmission. But it's not possible to keep it forever because the COVID won't go away as long as there are susceptible people. So what the lockdown has done, it has really given the health system, the country, an opportunity to do those preparation and readiness issues. So we had to then start to consider what is the social impact of the lockdown, what is the economic impact of the lockdown, and balance that with the levels of epidemiological and the restrictions of individuals. So the lockdown, we knew that as soon as you lift the lockdown, what was driving the epidemic is going to come back and create another push to raise the epidemic. What is driving the epidemic? One is that the virus itself has got its own qualities of transmitting itself very fast. Two, that people who contact someone with a virus, because they don't have immunities, the chances of getting an infection is very high. Three, the fact that most people will have the virus, but they will not know that they will be transmitting to other people. And four, travel, big gathering, schools and all that, those are trying to make sure that there are not many people who could be infected at the same time. So the lockdown, we found that we were expecting a rise, and we are finding a rise. And we have expected that people are going to be traveling, and people are traveling. We expected that we should use the opportunity of the people who are traveling to test them and screen them. We have found that actually worked very well between our border and Western Cape. But we're also doing a number of very critical things, is that we follow every person's network of contacts, especially those close contacts, so that we trace them and test them, and then isolate those people that are actually infected to make sure that they are not continuing to transmit. But we're also finding that many of the viruses epidemic happen in clusters. So a cluster is a wedding, a cluster is a funeral, a cluster is a community or a village or a township. Again, there we follow those clusters and come up. So in the post-COVID period, the things that are going to make us to be successful to balance the economic, the social restrictions, and the public health is to test, isolate everyone we find to be with COVID positive.
Now, HOD, many commentators have said that the picture in the province looks gloomy. What worsens it is the fact that there's still people who are not informed enough about this virus. Take, for instance, the issue of Libote, where people are still lending each other masks so as to access shopping centers. What sort of education or informing the people has the department done, particularly in the rural outskirts of the province?
Yeah, I think it's very important that we should understand that what you see in the Eastern Cape, what you see in the Western Cape is actually a period of an epidemic that's probably 3 or 5 weeks ahead of other areas. There is no area that is actually safe from rise in the numbers. What we are finding in the province is that PE, Port Elizabeth, that's a Nelson Mandela, BCM, that's the East London area, and the Chris Hani areas. These are places where there's huge economic activities. There's high mobility of individuals. There's clustering of people in very close space with communities and households with more than 10 people. And then we find this as a driver of the epidemic. So what we're doing then is that we're trying to limit the funerals, we're limiting the SASA, we're making sure that we're following everyone up, and we're tracing and testing and isolating every person who's infected.
Doc, thanks a lot for your time, sir.
Thank you.
And that's, of course, the HOD of the Health Department in the province, Dr. Zweli Mkhize, telling us about the measures they've put in place to ensure that the spreading of this virus is contained. We do know that any time from now, the Minister of Health, Dr. Zweli Mkhize, will be here. He will then move to Cecilia Makiwane, sort of to check if there are the systems in place there, should the spread continue, are able to handle the numbers of those who will be hospitalized in that hospital. From us here in East London, it's back to you in Studio Plain.